Welcome everyone. Thank you for joining me today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Dr. Ahmed is away today. Today we are reporting an increase of 24 new cases of COVID-19 in Windsor and Essex County. 11 are close contacts of confirmed cases, 8 are community acquired, 1 is outbreak related, and 4 cases are still being investigated. We have had 16,460 cases since the beginning of the pandemic. 266 people are active at this time, with 129 of our active cases being a variant of concern. To date, 1,682 preliminary or confirmed variants have been identified in Windsor-Essex County, with 1,554 cases having the UK variant, 4 cases with the South African variant, and 4 cases with the Brazilian variant. 18 people are currently in the hospital and 5 people are in ICU. Our community has lost 426 people to COVID. There are currently 11 active outbreaks in Windsor and Essex County, 10 workplaces, and 1 community outbreak. Regarding the vaccine rollout, 256,477 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 234,858 people have received at least 1 dose. Overall, 68.4% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. Residents of Windsor-Essex County 12 years of age and older are able to book their vaccine appointment at one of our mass vaccination sites in Windsor and in the county. Please book your appointment at wevax.ca or by calling 226-773-2200. People are also able to receive their first vaccine at a participating pharmacy or primary care provider. So far, 2,500 Windsor-Essex County youth between the ages of 12 and 17 have received their first dose of a COVID vaccine. 25 pharmacies are currently offering second doses of AstraZeneca to those people who received their first dose March 10th to the 19th. Please visit our website at wechu.org for more information. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Yes, good morning. It's been over a month now since the outbreak was declared at Southwest Detention Center. Do you have a sense of what the current situation is like there?
I don't have it up. I don't have it pulled up on my laptop right now, but we do have a daily report, and I am not completely sure, but there is a rescind date, planned. And I don't know exactly when that is, but it is always contingent on not having any more cases in a period of time. But I believe they are progressing toward being rescinded, but nothing else comes to mind as being of concern at this time.
Thank you. I also wanted to ask about the Isolation and Recovery Center. Do you know how much that's being used right now, what the capacity is like, and has it had to be used less now because of the vaccine rollout?
So I can speak about the isolation hotel that is being used for farm workers. And right now we do have some people isolating in in the hotel based on being high-risk contacts of a case. And other than that, I don't know exactly if there's anyone else in the hotel, but right now there is a small group there.
Thank you. And do you know how many farms or farm workers have been vaccinated so far?
I believe at last count, it was around 5,000. I don't have the exact number. Last week, with the help of the municipality of Leamington, and we were able to do a couple pop-up clinics in that area, specifically targeting farm workers that had not been vaccinated. And we did that last Thursday and Friday. And between those 2 days, it was just like an evening 4 to 8 clinic. we did about 400 people, and most of them were farm workers. So we were happy to offer another option if people had not been immunized at our clinic at Nature Fresh in Leamington. But I can get that exact
Thank you
number.
very much.
Yeah, I can get the exact number. I'm thinking it's around 5,000.
Thank you.
Any questions from Blackburn?
Not today, thank you.
Any questions from the Windsor Star?
Yes, good morning, Teresa. Dr. Ahmed said last week that the epidemiologist was working on a report about COVID-19 cases among local vaccinated residents. Do you know when we might see the conclusions from that report?
So our epidemiologist has been working on that report, and I actually, received a copy of the draft and read through it, and we will, be providing some more information. I don't know if it'll be on the epi update tomorrow or the summary tomorrow, but I'll talk to Ramsey and see what we can add to that summary for tomorrow. But that did occur, so there is some good information there, and I will leave it up to our epidemiologist to be able to share that information appropriately.
Does it include information about severe outcomes like hospitalization or deaths among vaccinated local residents?
So that's a really good question, and we did look at that, and when we first in one of the first drafts, that was one of the questions on how to get more information about hospitalization and any outcomes related to the severity of the disease. So the draft that I did read, the most current one, has some good information about that as well. So I think it is very good that we share it with everyone, but like I said, I know the EPIs have are in the best position to present it. So I'm not saying anything that's not actually, confirmed by their numbers.
Okay, thank you.
Any questions from AIM 800?
Good morning. I'm just wondering if you have an overall or general report on how our local long-term care or retirement homes are doing. I know the province announced this morning some money to help invest in air conditioning and keeping those homes cool this summer. How have things been going in terms of tracking? Obviously, we haven't had an outbreak at a long-term care or retirement home for quite some time now.
Yes, so our health unit, we continue to support the long-term care and retirement homes because we have public health inspectors that are assigned to, they have a group of homes, and they're all assigned to the homes to do inspections and follow-up and support in the event of any outbreak as well. So all of that continues, and they are doing well. We know that they have a very good vaccination rate for their residents, and that has proven to be, a real change the path of what we saw, experienced last year. So regarding other improvements like you're identifying, like I'm sure depending on the home that all of that will occur based on increased funding and the needs identified by the home, but we continue to support them and mostly looking at their infection prevention and control measures as well, making sure they're still adhering to, all of the public health measures and other infection control measures that are mandated at all times. So we'll continue to support the homes, and everyone, this is their second really year of dealing with everything, and so they have good practices in place. The testing, the identification, all of that is in place. So those measures to prevent the spread of disease are being well managed by the homes. And you're right, we're very fortunate right now, and we hope that continues.
Do you know off the top of your head, Teresa, when the last outbreak was that was declared?
I don't.
I guess just like how long it's been since we've had an outbreak.
Yeah, it's been a while. I'll have to look that up too for you. You're giving me some homework, but that's a good.
That's okay. I'll bug Mike later for that answer. On the vaccination rate, this morning in Vanier, Ontario, it was announced that 25 staff members have tested positive for COVID. So in terms of vaccination rate here, do we know if all of our long-term care or retirement home employees are vaccinated?
The staff you're talking about at long-term care?
Yes. Yes.
Well, I can tell you they're not all vaccinated. So this is the COVID vaccine is a voluntary vaccine, and I don't know the actual coverage rates. You'd have to call the homes and ask them, but we know that not all the staff are vaccinated.
Okay, thank you.
Any questions from CTV?
Yes, good morning. As of yesterday, we hit the 60% adult vaccination rate required by the province to go into step 1 of reopening in 2 weeks. Has the health unit received any information if step 1 would start then on June 9th rather than on June 14th as they stated originally?
We haven't received any further information. So as you are probably aware, the vaccination coverage rate of 60% is just one of the indicators. And so it all is contingent on, the number of cases in our area, the hospitalizations, ICU admissions. So, there are other factors as well, but we haven't received any further information regarding the reopening and moving to, any change in date. So our vaccination coverage, though, is good and promising. Our case counts, we still have cases, so it's important to practice good public health measures and continue to get those cases down. But we'll see. We'll see what further direction we get from the province.
Okay. And with loosening restrictions on the horizon, does the health unit have any guidance for gathering at short-term rental type cottages for getaways and summer vacations?
So I did see that mentioned in the regulations. So I'd have to look at that. I don't have that information right now, but there are restrictions as well. But I'd have to find that out. Yeah.
No problem. Thank you.
Any additional questions from CBC?
Yes, one more. I'm not sure if you can speak to this, but some other medical officers of health in Peel and York are proactively calling for schools to reopen. Does the health unit have a position on that?
Well, Dr. Ahmed's not here today to comment on his position, and it really is a conversation that would be had with the medical officers of health. And we haven't, talked too much about that. I know that the group of medical officers of health did submit their a letter of their recommendations, but I'm not sure that Dr. Ahmed has talked about the schools. So I'd have to ask him personally.
I can send a link to the Council of Ontario Medical Officers of Health. I'll send you the letter.
Yeah, Mike said the letter I just referenced, he can send it to you, and you'll see that is a kind of a position by the medical officers of health across the province.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star? Okay. Looks like we lost someone. I think that's such.
Okay, thanks, everyone.
Okay. I guess